So, welcome to Wednesday webinars. My name is Andrea Salvadori. I am the Professional Development Officer at the European Foundation Center. And today we are very happy to host a great panel of experts. And we will be talking about breaking down grantmaking silos and mainstreaming disability as a way to promoting social innovation. I'm just going to tell you very quickly how this system works. You all have a panel, a window on your computer. You are all going to be muted by default, and that's why you see this gray icon. We will probably not unmute you if you have any questions, but please do click on the hand button if you want to attract our attention because of something that isn't working. And feel free to type in any questions you have, and we will have time later on for a Q&A. So very briefly, this is what is going to happen today. We will have a short setting the scene moment by Joe Andrews, and then we will hear from 4 different practitioners who will give us their take on ways to mainstreaming disabilities in their grant-making programs. We will have time for questions towards the end, so do feel free to send them in as you have them. And we are planning to end the webinar in slightly over an hour. I am going now to give the floor to Joe. Joe Andrews is the director of Ariadne. Ariadne is a network of European funders for social change and human rights. Joe, thank you for being here. The floor is yours.
Thank you, Andrea, and welcome to everybody who's joining this webinar, which is about breaking down grant-making silos and mainstreaming disability to promote social innovation. Over the past few years, we at Ariadne have watched the disability rights movement gather pace and strength, and recent developments have been much more strategic than in the past, as the movement has grown far beyond service provision and looked at ways of changing the nature of the environment for disabled people. Even so, many foundations, many funders, and even us as ordinary people have not yet made the mental leap to mainstream disabled people, instead thinking of them as a special category. We've had a tendency to believe that work on this topic is the preserve of those who specialize in this field, rather than the concern of all of us. But this webinar is about seeing how far we've moved towards breaking down those barriers and mainstreaming regard for the problems of the disabled, so that environmental funders, human rights funders, cultural and arts funders, funders of women and girls don't forget the disabled and bring them instead into the front and centre of their grant making. Andrea has set us a really punishing time schedule for this, as we have 4 contributors. So I'm going to crack the whip and ask that each speaker speaks for no more than 10 minutes. I'm not quite sure if Andrea mutes me, how I'm actually going to physically prevent you from doing this, but I will rely on Andrea to give me back the microphone after 10 minutes.
I will.
The reason for this is not to cut you off in your prime, but it's to allow enough time for any questions at the end. The first speaker is Cecilia Conde from the European Network for Corporate Social Responsibility and Disability, and she's going to explain to us the efforts they're making to mainstream disability into the agenda of those pursuing corporate and social responsibility programs. Cecilia.
Hello, many thanks, Joe. Good afternoon, everybody, and thanks very much also to all the organizers and participants attending today the webinar. Just one moment till I can show these slides to all of you. Just let me know whenever they are visible for you.
We can see them.
Yes.
Okay, great. So as Joe was saying, my name is Cecilia Conde from the European Network for CSR and Disability, and on behalf of Fundación 11, as leader of this network, I would like to give you a very brief introduction, less than 10 minutes, of the context of the forthcoming publication, Breaking Down Grant-Making Silos, Disability as a Cross-Program Initiative, explaining you its background and also the different players involved. Please let me introduce you in the first place the European Network for Corporate Social Responsibility and Disability, a transnational and multi-stakeholder initiative led by Fundación 11 and co-founded by the European Social Fund, which brings together companies, public authorities, social economy organizations and other entities working on CSR to promote that the visibility dimension is appropriately taken into account in CSR policies and strategies, both in the public and private sectors. Fundación 11, as leader of the initiative, works together with Telefónica in Spain, L'Oréal in France, and the Italian Ministry of Labour and Social Policies in Italy as the networking founding partners in the completion of different objectives, such as the exchange of good practices, networking, multi-stakeholder dialogue, information and dissemination, policy influence, social innovation, and also social entrepreneurship. The CSR+D European Network is also a collaborative project recognized as part of the key European CSR initiative, Enterprise 2020. Within the network, we are now launching a new initiative called Agora+D. This is a new open platform that will gather good practices reflecting the integration of disability in CSR, social innovation, and social entrepreneurship strategies of both public and private organizations. Agora+D, as the word agora in ancient Greek indicates, comes from the idea of generating collaboration, discussion, and awareness through an open, free physical and online platform. Some of its main objectives include the generation and sharing of knowledge and experiences evolving from the inclusion of disability in CSR, social innovation and social entrepreneurship agendas. Also, spread innovative, efficient, and realistic good practices, bring together companies, social entrepreneurs, foundations, corporate funders, and public administrations under a transnational and multi-stakeholder platform, and also, of course, address inspiration to all kinds of agents wishing to integrate disability in their projects in a competitive and effective way. Agora+D will include good practices coming from different types of organizations. This is companies, social entrepreneurs, public institutions, and of course foundations, which is the center of our discussion today. In particular, the foundations category is being developed with the support of the European Foundation Centre, the EFC, through the European Consortium of Foundations on Human Rights and Disabilities, in which Fundación 11 takes part. And back to the beginning, within Agora+D, the EFC, in collaboration with ESL Foundation, are working together in the development of this publication, Breaking Down Grant-Making Silos, Disability as a Cross-Program Initiative, which gathers good practices addressed to foundations and corporate funders and explores the intersection between disability and other funding priorities, such as employment, youth, aging, gender issues, research, environment, access, cooperation, development.
Cecilia, have you finished? Have we lost Cecilia, Andrea, or has she finished?
I'm afraid she's still, her microphone is still on. I don't know if she, this was her last slide. I don't know if she can still hear us. Cecilia, give us a sign of...
Live.
There might be a problem with her microphone. And I see that she has just lost connection. So,
okay.
Last slide.
Yeah, well, there we go.
Well,
that was admirably well timed, but admirably short. I was going to ask who she hoped would be able to use this resource, but if she comes back on, we will ask her, and we will move to the second speaker, Brian Kearney-Grieve, who is the Program Executive for Reconciliation and Human Rights at the Atlantic Philanthropies. Atlantic, as I think we all know, closes in around a month's time after many years of funding expertly in the field of disability. This leaves Brian at a moment where he can look back at what he's learned and what the lessons are for all of us. Brian.
Good afternoon, everybody, and thanks for the opportunity. I'm going to get straight to it because not only is Atlantic running out of time, but we've got a very short webinar today. So really what I'm going to try and talk today about is our experience that we've had here in Atlantic, give you a bit of the context, what we've done, and then what we've learned from that. Hopefully you'll find it useful. So, as Joe said, we're a limited life foundation, and we're making our final program grants at the moment. I actually finished with the foundation at the end of this year.
Brian, if you can, I'm going to stop you for 1 second. You're coming on a little too loud. I don't know if your microphone is maybe too close to your mouth. If you can try and adjust a little bit, we're having a little bit of a hard time understanding everything you're saying.
Okay, is this better now?
Slightly.
Okay. In other words, my microphone is too good. Apologies for this. Is that better?
Let's go on and we'll see if there's any. We'll interrupt you again. Sorry about this.
Okay. All right. Look, I can try something else. Just give me 1 second.
Sure.
How is that now?
Try again. Say something more.
Okay. Is that any better?
Slightly. Let's go on.
All right. Okay. All right, so just to give you some context from where our program started in the area of disability, we're looking really at increased demand for health and social services, and there are needs really to reform existing provision against the constrained fiscal background here in Ireland. I'm sure that's familiar in most other countries. But that provides both challenges and opportunities. And really we were looking at how to develop better ways to support people who are disadvantaged and vulnerable to live full lives in the community. And that's not just in the area of disability, but we also have programs in areas such as aging and children and youth. But looking specifically, first of all, at disability, we recognize that disability in some form will affect most people on a temporary or permanent basis, either directly or indirectly at some stage in their life, irrespective of their socioeconomic status. So, this takes us then to the issue of life course, and I'll come back to that. But we know that, people with disabilities is possibly the largest minority group in the world, and it's likely to increase in the years ahead for a number of reasons that I've listed there on the slide. But what we also know is that societal attitudes and a dominant medical approach traditionally have resulted in many people with disabilities not having access to the supports and services that they require to lead lives with dignity and respect. And often results in their isolation and institutionalization. And despite knowing this, disability is an area often not considered or included by foundations and other funders in their programmatic area for issues. And we find this in a complex public system with ingrained practices and vested interests. And those practices and systems and services find it very difficult to reform themselves. And this may explain some of the reason why foundations have been hesitant to get into this space and try and address the issues. I think our view is that foundations can play a critical role in bringing together and providing essential resources to support service providers, service users, and service commissioners, i.e. governments, in the process of not only reimagining how services can be provided, but also transforming how those services are provided, and linked to that how governments and others fund those services. So it's really the context in which we came at this on. All right. Some of what we've had to change in terms of our own thinking is how we actually approach this and the frame in which we approach it through. And do we approach social services and accessing social services by age cohort or need? So do we look at it for children or for aging people or people with disabilities, or the need that a person actually experiences at a different time point in their life cycle. And it might be the same need at different points in the life cycle. And so what we're saying is if we can reframe how we come at this, does this give us the freedom to think differently and act differently to solve the seemingly insoluble problems that we're facing and reframe public policy accordingly. So we move away from silos based on different age cohorts to keep transition points that might occur at any time in our lives. So it might be from entering school, from primary to secondary school, from leaving school to university, leaving university to entering the workforce, those kinds of key transition points. Right. The other part of trying to think through this is how do we move away from that position where we discount people for whatever reason, resulting in people being viewed or treated as somehow being less deserving of respect and part of the mainstream. So it's because of those views that they get excluded from the mainstream. So older people, young people, people with disabilities, mental health difficulties, migrants. We could go through a number of people in that way. But really what
Brian, I'm just going to stop you. It sounds as though you've got a herd of dinosaurs. Hi, Brian, can you hear me?
Yes, I can, Joe.
A herd of dinosaurs. Sorry. It just sounds as though, keep talking, it may be interference on your line, or it may, is there a lot of background noise where you are?
No, none whatsoever.
Ah, right. Well, keep talking and we'll hope it goes away.
Okay. Yeah, I can hear that. That's not me.
I'm trying to see who it can be. Everybody else's microphone is muted, so it's just a technical problem that will be resolved very quickly. But just for everybody to know, as you'll see, most of the slides will be are full of text, which actually comes in very handy. You will be able to find most of the information that has been said on these slides. Unfortunately, do not have any kind of system for people with hearing disabilities to follow us, but we've asked our speakers specifically to put as much text as possible on the slides. Brian, I do think that we have a problem with your microphone, so I do invite you to maybe unplug it and replug it, and maybe lower your volume, and then we will come back to you. Let's see if it's working better right now. Can you still hear us?
Just give me a second. Okay, is that any better?
There's still a bit of an echo, but let's try and go ahead.
Okay. You can hear me okay?
It's still a little bit disturbed.
All right, apologies for that. What I'll do is I'm going to skip some of the text then on that slide on reframing, because we're just running, I know I'm going to go over the time otherwise. And really just taking you to some of the work that we've done in terms of trying to mainstream this work and support innovation. So one of the things that we did was we established a new organization, Genio, which is focused on promoting and embedding a person-centered approach to how social supports and services for people with disabilities and mental health difficulties are designed and delivered. And the reason for establishing that organization was that we saw there was a real need to have some space in the area where there was a group or a facility without a vested interest that could bring the various stakeholders together to look at new ways of doing this. And they really looked at three key activities, or undertook three key activities. The first was funding, which was provided to demonstrate sustainable, innovative practice on a competitive basis, which service providers and other organizations could apply, but had very clear criteria that they needed to meet in order to access that funding. The second one was around capacity building, so building capacity of service providers to transform the way in which their services were provided, but also capacity building for on the demand side, not just on the supply side, but on the demand side for people with disabilities and their family members to start demanding this new way in which services should be provided. And then the third element was to commission independent evaluation of how these new approaches were working and what outcomes they were delivering for people, and also whether this was cost neutral, whether it cost more, cost less, etc., which becomes very important for those that pay for the services into the long term. The initial focus was really around disability and mental health, looked at person-centered approaches, looked at facilitate deinstitutionalization, and in the mental health area really looked more at the recovery model approach than the more traditional institutionalized approaches. So over a 5-year period, 227 projects were funded through 2.3 million in funding from a combination of philanthropy and government, which leveraged 31 million from service providers themselves, and that illustrated how reform can be embedded into the system. So it's actual projects that have brought about real change that is being sustained in the sector and resulting in better outcomes for people with disabilities. But what's really interesting from this is now that we started in the disability and mental health side, and now our aging program has started to adopt the same approaches in areas such as dementia, Alzheimer's, Parkinson's, etc., and looking at how can they use these approaches to meet specific needs of people in the aging cohort or in the aging program. And now we've got government also looking to mainstream these approaches across the whole of the disability services, but also how they might use children with challenging behaviour, children that are in the penal reform system, and also people that are homeless. So we're seeing it started to be mainstreamed in a number of different places that we hadn't intended in the first place, but we're very encouraged by it. If we look very quickly at innovation in terms of policy, things that we've done there are around legal capacity and assisted decision-making legislation. Again, it started very specifically within the disability field, but has moved very quickly into the whole area of aging, dementia again, Alzheimer's, things like that, and also into the younger cohort. We're also seeing 3 centres that we supported separately within 3 program areas, so one on children and families, the other one on aging, social gerontology, and the other one on disability law and policy, coming together to create a life course institute at Cornwall University. And the picture that you see there is of a purpose-built building to bring those 3 centres together and to come up with a common and shared research strategy that is aimed specifically at policies across the life course. And then there's 2 other further examples there. One of an intellectual disability institute at Trinity University, which is now was a standalone institute and is now being mainstreamed and integrated into the School of Education, which shows how disability is now being, and access to education, being mainstreamed into a 3rd level institution. The 3rd example that I've given you there really is around intellectual disability being incorporated into longitudinal studies on aging. So there's aging now starting to assimilate and bring in disability issues into the research that they're doing and getting the evidence base that's required to inform policy. So just very briefly on the final slide, just some guiding principles that have emerged through this work and some of the lessons that we've learned. I think the first one is, especially when we're talking about mainstreaming, is this principle of do no harm. Even if you're not funding disability issues specifically, the challenge is to look at the programs that you do run and the CSR that you run and to determine whether you are even unintentionally causing harm to people with disabilities by excluding them from the work that you are supporting, or that those that you're supporting, do they include or further marginalize people with disabilities. The next point there is very quickly is being aware of intersectionality and how we can support intersectionality, which is that people have multiple identities, not just a single identity. And by taking that approach, helps to combat that different issues competing for scarce resources. So it becomes a hierarchy of needs. We found it very important from the beginning to develop a collaborative relationship and options between government, service providers and people with disabilities. And this has been very important when you're moving from pilot or demonstration of an approach to then trying to embed it in the broader system. So doing that from the outset tends to bring people on much quicker and enhance what we've also learned is that it's not the difficulty is not knowing what needs to be done and what needs to be changed, but actually how you go from where you currently are to transforming services the way in which you need to be doing it. That transition process is the real challenge and where resources are required. And in order to do that, it's really important to develop both the supply side, in other words, how those new supports and services are provided, but also ensuring that people are demanding those services, so developing the advocacy and the user's voice to demand these new approaches and ways of things that can be done. Evaluation is very important. It's important to look outside your own organization, field and country to imagine what is possible. And to do that when you're doing it as a group, not just as providers or users or funders, but collectively to do that. If you're supporting this type of work, would suggest that it's critical that you provide organizations with multi-annual core funding. You can't do this in a year. It takes multiple years to achieve the outcomes, but you can achieve them and they are sustainable. And in order to do that, ownership and partnership are critical. And the final point would be from a funder's perspective, because you're trying to work in partnership, using the approach of contribution. The contribution that you're making to this change is far more important than having it attributed specifically to your individual contribution. It helps that whole partnership approach. And I'll leave it there. Thanks very much. Hopefully you heard most of that.
I hope we did. It's the first time I've heard a ghost dog on a webinar like this. But I'm just going to summarize very quickly some of those very good points at the end that Brian was making. One, do no harm. Two, remember the multiple identities of people and come up with a hierarchical need. Gosh, we've still got the ghost in the machine somewhere, Andrea. The third point, that the collaborative relationship is important, but the transition process is also important, and that what you need to make this work function is core funding over multiple years. It can't be done at one go, and equally, what's really important is the partnership contribution to change. It's far more important than attributing change to one single foundation. Andrea, I'm just going to quickly ask you if there's any way in which we can get rid of the noise that's coming across our headphones, or if this is a lost cause.
I am afraid it's a bit of a lost cause. I've been trying to mute most of the participants. Actually, all the participants are muted. We will just have to go on one mic open at the same time, and hopefully we won't be feeling like we are in Jurassic Park anymore.
Okay. It's very interesting.
It is.
But there we go. It is. The next speaker is Rana Kotan. I should say thank you, Brian, for that and for trying in difficult circumstances. Rana is the Director of Programs and International Relations at the Sabanci Foundation, and he is going to look specifically at the double discrimination faced by women in Turkey with disabilities. Rana.
Hi, everyone. Thank you, Andrea and Joe, for this opportunity. As you may know, Sabancı Foundation is a grant-making foundation, and we have been supporting non-profit organizations which promote access to equal opportunities for women, youth, and persons with disabilities. And one of our priorities is to support projects in cross-thematic areas like women and disabilities. And before explaining our work in this field, I would like to give you some information about the situation of women with disabilities in Turkey. Wait, I can't change my slide. Okay. Women with disabilities have a double disadvantage because they are women and they have a disability. And they are raised in such a way that they feel they cannot do anything in life. They are not capable of protecting their chastity, so they're not empowered. And they face discrimination not only by society but also oftentimes by women themselves. And in Turkey, about half of women with disabilities are illiterate, let alone having a school degree. Only 7 of them can join the workforce, and only 1% of them have a university degree. So it's a pretty severe situation. And these women face all these challenges, and a group of empowered women who are disabled themselves decided to establish an association of their own. They needed a separate association to address their specific needs because organizations working only on women's rights in Turkey, they don't have a disability lens. And organizations working only in the area of disability are mostly male-dominant, and they don't really take women's needs into consideration. So a specific association to address women with disabilities was needed. And women that are, as I said, disabled themselves decided to establish this association 3 years ago. And the first project that they implemented is called Rights-Based Struggle of Women with Disabilities, supported by us. And what was this project all about? The project had several aims. The most important aim was to reach out to women with disabilities. This is important because most of those women are kept at home. They don't go out, they don't socialize. Therefore, the first thing was to get them out of their homes. The second aim was to inform them about their rights because they don't know their rights. The third aim was to encourage them to take an active role in solving their own problems. And the fourth goal was to invite them to raise awareness about their issues in their families, in their communities. And perhaps a more advanced goal, and I didn't write it here, but was to help them establish new associations, new entities, if possible. Until now, we have reached 160 women with disabilities in 8 different cities in Turkey. As I said, it's been 3 years that we have been supporting this association. For the first time in Turkey, this association designed a training.
I'm going to interrupt you 1 second. We're going to try one last thing. If anybody is in the audience is calling in through your phone, please make sure that your phone is on mute. So if anybody is calling in I have muted you from my side, but if there's anybody calling in from a phone, please mute your microphones. Sorry, Rana, go ahead.
Okay. Sorry, it's pretty disturbing, but I'm just trying to continue. For the first time in Turkey, the Association of Women with Disabilities designed a training to address the specific needs of this group. In the first 2 years, we reached 120 women in 6 different cities. They participated in the trainings. And after those trainings, some of those women decided to continue their education or start working. Many of them decided to become a member of the association. There is a city called Bursa. Women in Bursa established their own association of women with disabilities. And there is another city called Trabzon. And the women in Trabzon prepared a documentary film for the first time in Turkey about the problems and discrimination they face. So these are all the good developments from this adventure. And what will happen next? 40 more women will take the trainings in 2 different cities. They will produce a report on violence, because violence is a major problem that they face. And they will also prepare a frequently asked questions document about the specific questions of this group. And I would like to also share with you a quotation from one of the women who participated at these trainings. She said, "This project made me realize that I am strong as a woman and not desperate as a person with disabilities." I think that statement really shows what she gains from this training. And I will stop here, and I will be happy to answer any questions you may have.
Rana, thank you very much for that. I know the circumstances are difficult. I just wondered if there was any data so far on the impact, or you knew anything about the impact that this work has had on the lives of those women, because the figures that you showed us at the beginning were pretty stark in that 48% of women with disabilities are illiterate in Turkey.
Yes. Actually, our project doesn't involve anything about improving the literacy rate or university entrance rates. Our program only involves the empowerment of these women. And like change happens really slowly, and with time we believe that as they become more aware of their rights, as they get more empowered, etc., they will slowly start working or continue education or get the control of their lives. But we don't have a specific program, as I said, to support their literacy or education. But we have been also undertaking a monitoring and evaluation work. And I cannot tell you any numbers, but we have gathered many stories of what changed in their lives. And we also witnessed a major capacity development in the association itself, because this is the first time that these women came together, they founded an entity, and they have been implementing a project. So this is the first time, and even the capacity development in this association is very significant. It's a unique association. I mean, they're the only one in this niche field, and they don't really have all the skills, or they didn't have all the skills in the beginning. But with our support and also media support and all the technical support, they have become really powerful. And what else can I say?
Do you expect more women to follow their example?
Definitely, definitely. Already women started to establish new entities, just because they're taking this as a role model.
Go on, Rana.
Yeah. So these women are a role model for them, and other women already started getting organized. They learn their rights, they learn how to establish a rights-based organization, and after they have all these skills, they start acting. And more people and women, I think, will be joining them. But as I said, change happens pretty slowly.
Good. Thank you very much indeed for that. It was extremely interesting. I'm going to turn lastly to Michael Fembeck of the Essel Foundation. Essel and a number of other foundations have been involved in an ongoing piece of research which looks at good practice from a number of European foundations and considers what others might do to improve their practices. Michael, if you can cope with Jurassic Park happening in the background, please take the floor.
Yeah. Well, hi everybody. Well, I'm sitting currently at the Starbucks at Luton Airport in London, so I may add some occasional announcement or Christmas song to the background, but I'm definitely not responsible for the dinosaurs. So
I think the Christmas song would be an improvement.
Well, what I'm going to do now is I'm going to focus on 3 things. One is tell a little bit about the Zero Project research which is the key why we are cooperating and why we have been taken as a partner to research the work of foundations in Europe on disability. Second thing is I'm going to give you some of the framework for the research that we've done, and thirdly I'm going to present some preliminary results of that research. So first let's start with the Zero Project research. The Zero Project is a project started by the ESL Foundation, but not only done by the ESL Foundation. We have several operational partners. One of them is the European Foundation Center itself, and we're very happy about that. What we do is we research best practice examples to improve the situations of persons with disabilities worldwide. Actually, we don't call them best practices, but because this is seldom really best or even good, so we consider them innovative practice and innovative policies, considering the developing nature of all the practices and policies that are currently around. We have chosen 4 topics. We have started in 2013 with employment. We have accessibility in this year's last year's research and this year's publication. We are currently finishing research on independent living and personal and political rights. And in 2016, we're going to research education, and 2017 we most probably restart with employment. We have another area of research which is social indicators that measure the implementation of the UN Convention of the Rights of Persons with Disabilities worldwide. The research that we do is based on a very broad network of experts that contribute in one way or the other. Since 2011, since we started the Zero Project, more than 3,000 persons have contributed or participated in one way or the other, and in this year alone it will be probably some 1,500 in the full year's cycle. Foundations are, of course, a very important part of that network and of those organizations that contribute. We have some 75 identified that have contributed in one way or the other. Of course, not everything that is called a foundation in a worldwide context is a foundation, and not everything that works like a foundation in our understanding calls it a foundation. So this is just some rough estimate of the number of foundations that are taking part. Well, and of course we have developed some basic expertise about projects of foundations and what foundations do in Europe. So that was most probably the reason why we were asked to partner with Fondation ONCE and CSRD in doing that research. So what is the framework? What are the goals of the research on good practice? We have identified 3 goals. We want to show the diversity of disability programs that are organized and financed by foundations in Europe. We want to show that foundations are and work at connection points of many very, very different organizations, like governments, like NGOs, like social entrepreneurs, like companies, businesses, academics, international organizations, and many more, and all of them tend to work in their own silos. So this is, as far as I can see, the real added value that we as the Zero Project are adding, and what also this publication, this booklet can do to show that the importance of foundations that work at these connection points, and that are in a position also to connect and to look at it from at broader horizons, and are able to work with all these different stakeholders and different parties, which is not so easy for most of the others. And finally, we want to show that foundations consider disability a cross-cutting and inclusive issue, which was already mentioned by Brian and also by Cecilia and also Rana. Foundations, many foundations, or I would even say most of them, don't say we are focusing exclusively on disability, but we see this as a cross-cutting issue. We work on something, but we want to include, to be fully inclusive for persons with disabilities as well. So this is another added value that is in many cases overlooked that foundations provide, and that's another goal that we want to show with the publication. So what did we do so far? We made a call for good practices supported by the European Foundation Center and CSRD to 25 European foundations that we had pre-selected, that we knew are working on disability issues or on cross-cutting issues. we developed a questionnaire and sent this out. This was the tool that we used, and we got in touch with 24 programs that were either nominated by those foundations or the nomination was discussed with the ESL Foundation if we think that it should be part and if they should nominate it. So there was for some weeks we had some intensive discussion with foundations, and finally we ended up with 12 programs from 12 different foundations from 12 different countries that we at this point decided to include in the publication. We used a very common categorization of programs that are normally run by foundations. Disability related to the life cycle approach, disability and women, disability and youth or employment issues, disability and research, disability and health issues, disability and environment and research, disability and children, disability and culture, and disability and development. So this we used as a categorization, and then we took those 12 programs and looked at which categories they belonged. And what you can see on the screen is the results that we currently have, and I say currently because it's still not finished. We are still talking to one foundation or the other, also about categorization and also about including one or the other. But what you can see right now is what we currently have done so far and where we are. So we have Brian and Atlantic Philanthropies and their cooperation with Genio as a life cycle approach. We have an approach by Fondation de France, which is working also on sexuality and disability. We had the one that Rana just explained, Disciplined Woman from Sabanci, and I'm not going to mention all of them because you can see it on the slides. To stay in time, I'm moving to the conclusions. What we found so far is some overall conclusions is that foundations are taking the lead in changing systems and also changing paradigms in many cases, especially in the very important issue of institutional care and closing down institutions. This is probably easier for a foundation that is not dependent and has no other agenda as to work for the rights of persons with disabilities. So it's easier for them to work on paradigm shift, and we see this as in many cases as their mission, and they really do that. So that's what we found. Not really surprising is that most foundations work on innovation and social entrepreneurship. Most foundations also, as we have stated at the beginning, and also as it was described by Rana and Cecilia, are working on cross-cutting issues and not seeing disability as a single problem to solve. Many foundations tackle minority issues or even stigmatization, as for example Fondation de France with this project that works on sexuality of persons with disabilities. So this is also a very important role of foundations to try to bring those issues into mainstream discussion at least. Foundations also are creating role models that are scalable and can easily be copied and transferred to other regions. That's of course in the genes and in the heart of many foundations' work, that they know that they cannot change the world, but they can change the mainstream opinion, because they can influence political decisions and mainstream media by bringing those projects to media attention and to the attention of decision makers. And finally, what's also important, many foundations, not even one foundation that we found, thinks that what the foundation is doing can be regarded as a surrogate for welfare states, not even in times of austerity measures, because it's not possible, and it's not in the heart of foundations' work. Even in some cases, if this is discussed in one way or the other, there's no way that foundations can take over that role. So these are some preliminary conclusions from the work. We're going to publish the work in early 15. No date has been set, but most probably the first concrete results will be presented at the Zero Project Conference in Vienna, which will be by the end of February. So that was my presentation at this point.
Thank you, Michael. Could you just explain how you hope that foundations and other funders will be able to use this research?
Well, there's one very clear mission of this publication, but I think you should ask the same question to Cecilia, because they are also we're doing this together. We as the ESL Foundation are just doing the research. So it's a publication of CSRD and of Agora plus D. So, but from my understanding, it's of course also addressing all the other foundations that are currently working and bring this to their attention. Also get a discussion going with them, how they also could see what they do also in cross-cutting lines with disability as well. So include, as Brian said, do no harm. This should be the least that every foundation should consider. No?
Okay, I'm not quite sure if Cecilia's back with us. If she is, and if Andrea can unmute her microphone, it would be very nice to hear how she hopes this research will be used.
Hello?
Hello.
Hello, everybody. Hi.
Hi, we can hear you.
Okay, great. Yes, Michael was saying, this publication is part of the CSR plus the European network, and about this new open platform that it's Agora plus D, which will be an online free online platform that any foundation, organization, or any agent interested will access, and also will be a physical platform in the sense that we will create specific events so that any kind of agent can participate. And the objective
and you hope
of this is to
carry on, Cecilia.
Yeah, sorry. No, yeah, and we just hope like this online platform will be like a database, a multi-sectorial, so it would also serve as inspiration for any other foundations, corporate funders, or any company just wanting to get good best practices.
And what's your impression with the corporate social responsibility programs? Is this something that they're really interested in, or are they more wanting to carry out the sort of service funding that we have come to think of as more typical from them?
Yeah, so far we have to say that there are many people and organizations and agents, including foundations, interested both in participating, so like to give visibility of their own best practices, and also to understand and get to know new best practices that are taking that some other organizations are leading in Europe, but they could also observe them as an example or also something new, a new practice.
Okay, well, if anybody would like to ask any questions, then please type your question, and I hope that Andrea can relay that to any of us who are still here. You can see on your screens the addresses for all of the organizations that have been taking part in this. This webinar is being recorded, and it will be on the European Foundation Centre's YouTube channel, and I will also upload all of the presentations to the Ariadne portal in the disability community, which actually is a joint community of the European Foundation Centre and Ariadne, so I think a number of you are members there, and it's a good place to store those kinds of documents. Andrea, does anyone have any questions?
No, we don't have any questions.
Or am I allowed to go on asking questions?
You are allowed to ask more questions. I would like to invite anybody who's following us, of course, to ask any questions, to type them in, and I'll be happy to read them out loud. Also, if you have any questions later on, I do apologize for the noise issue that we've been having, and I do invite you to go through the slides as that we'll be sending later. And if you are watching this again on a recording, do feel free to get in contact with us at the European Foundation Center for any extra information on this. But Joe, if you have any questions to the speakers, please go ahead.
I was just going to, I was really going to ask Brian, looking at this, it looks to me as though a number of foundations have been taking the lead in this work, but that it is still very much isolated foundations in isolated countries, and that it's still an upward struggle to persuade, if you like, the more mainstream foundations that this is something that they should take seriously and that they should mainstream. Is that being unfair, Brian, or do you think it's fair?
I would say from our efforts to try and encourage other foundations and potential funders, and I would try and broaden it out just from the traditional private foundations. I think our efforts to try and get other funders into the space have not been an overwhelming success. There are a small number of foundations that are very dedicated to this work, and I think it's those foundations that have a specific focus on disability, and I think even within our own foundations, trying to mainstream it more broadly into other program areas within our foundations, it is quite difficult. And it's
Do you have any insight as to why?
I think at times it's because it might be because it's seen as being an area of charitable pursuit, and we look at people with disabilities in terms of deficits rather than in terms of their ability, and that there is an opportunity here to make a significant impact in people's lives rather than looking at them as causes for our charity. And I think that is one of the real blockages here, is that also people with disabilities are so isolated from society, in so many societies, that they're hidden, they're not visible, and we don't, as societies, actually understand what is possible. So I think there's a real challenge to us as those foundations that are working in this space to make visible what is possible, and in that way encourage others to get involved in this work by example. That we can show that it is possible to make a difference, and a significant difference that is sustainable into the long term, and that these aren't areas that you work in that are just areas that just absorb massive amounts of money with no real difference. I think is something really important, a message that we need to get across. I think a specific thing that foundations can do here, and other funders, is shift the way in which the massive amounts of funding that are provided by government to provide services for people with disabilities, to shift how that is actually provided. So the real task to me is, how do we act as a facilitator of change, not a provider of services necessarily. And in that way, we can make a unique contribution and have a very, very significant impact, and leverage many, many times the investments that we make. And I'll give a very specific example here. We're looking currently at making final investments in this area in Ireland as we pull out. And we might be, for some foundations, be making very big investments. But the prize is to shift the annual spend in excess of 2.4 billion per annum on disability services funded by the state. So you can have a significant impact even with this fairly small amount of money. I think that's the message we need to get across.
Thank you. Rana, I think you're probably still there. Brian's talking about the foundations being the facilitator of change.
Can I interrupt 1 second? Sorry.
Yes.
I think Michael had wanted to comment on this as well, and I would like to highlight that we've received a few questions. Some of them are ready for you, Michael. So I'm opening up your mic. Somebody in the audience is asking if new experts can take part in the Zero project research, and if yes, how they can go about this, who's the best person to talk to. And there's another person who was asking about if you could repeat when the publication will be available. I understand it was sometime in early 2015, but if you can expand a little bit on where it will be available and how participants can have access to it. So this is some of the questions. I'll throw one last one out there, but to start answering, and it's about whether this research has brought any insight into what issues within the disability world are actually getting funding from foundations, if there's a specific area that is being funded, and whether through this research you've been able to establish how much funding is available from foundations across Europe for disability issues.
Okay. This is several points, and I will try to cover one after the other. If I forget something, please remind me. First thing, I'd just like also to comment on Joe's question on why foundations are not so closely cooperating. I think this is also just if you look at the broadness of the issue, how many different goals and problems are to solve. We're covering with our Zero project and the research that we're doing, we get hundreds of nominations with every call. If you only look at accessibility, it means accessibility of built environment, of infrastructure, of trains, of buses. It means accessibility of products and services. It means accessibility of internet. It means accessibility of and so on. And if you look at it closely, it's even more complicated. So most of the foundations work on something, and still it's very, very different what they work on. So this is just also, I think, a question of the broadness of the topic. So to answer, to comment on that. One question was about about the date of publication. Well, we haven't decided yet, but it will be probably at the end of first quarter of the beginning of second quarter of 2015, when it will be available online as a PDF and also as a printed version. Cecilia, if you have more to say on that, because you're the publisher, then please, of course, tell me. But that's the plan that we are currently working on together with CSRD and Agora Plus T. And regarding the facts and figures about how much foundations are funding. Actually, as I described, we are still having a kind of anecdotal evidence, and we picked out 12 out of them, so this doesn't give any indication about how many projects are out there and how much funding is involved.
There was one more question about whether there's still time to take.
Yeah, sure. Yeah, please, everyone, get in touch. This is a network that is only as strong as the people who are willing to contribute. Contributing meaning nominating, commenting, evaluating, taking part in conferences, inviting us to do something together. So there are all kinds of cooperation, and this kind of flexibility is probably one of the strengths that we have. So everyone is welcome, and we are connecting with everybody. We have a team of people who are in the heart, and the strength is to connect to those that want to contribute and want to change.
Thank you, Michael. Joe, back to you.
Okay, I don't have any more questions. Andrea, do you have any others?
I don't. I apologize for the noise problem that we're having, and I'd be inclined to, as there are no more questions, wrap up and thank everybody for participating. Again, do feel free to contact me later on over the next days if you have any more questions, and I'll be happy to direct you to any of the speakers and any of the work that we have talked about. Joe, Rana, Cecilia, Brian, Michael, thank you very much. Thank you very much for everybody who's been patient enough to listen to us. Do get in contact with us, and remember that the slides will be sent to you, and that the recording will be available. And this will be it. So thank you again to everybody.
Thank you too, Andrea.